So what happens when you tell your therapist that you are having thoughts of suicide? This video is a breakdown of what happens next. So the first and foremost thing, your therapist is wanting to know what level of risk you are, because that determines where things go. If you're immediate risk, if they can talk you out of things, if they can de-escalate, if you're low risk, it really determines what happens next determines where you are. So that assessment phase, they're going to ask a ton of questions. They're going to ask about plan. They're going to ask about intent. They're going to ask about means. They're going to, it might be short, it might be in depth. If you are not immediate or high risk, they're going to switch over to kind of therapy mode. They're going to not only listen to what you have to say and be there and be present for you expressing your emotions, but also at some point they may switch over to problem solving. Okay, this is tough. We might not be able to trust you at the moment. Let's develop a safety plan. Let's make sure if this comes up and it's strong that you're going to be safe. So that'd be the next step, is going over a safety plan. Long term, they might kind of redirect the goals of therapy to be more about depression. So if you're working on anxiety and you're doing diaphragmatic breathing, progressive muscle relaxation, okay, they're going to switch over, focus more on the depression. Also in this treatment plan, they might have you see someone that can prescribe. There's some medications that are super helpful, some that you might want to avoid, but that's what you talk with your doctor or prescribing physician. So that's what to expect. With that level of risk, if you open up and you say, I'm having thoughts of suicide, they're not going to overreact and say, okay, you opened up, now I'm calling the police. No, that's like the last tier, the last step. If we can't do anything before that, there's lots of things that can be done ahead of that. We want you to be able to open up. We want you to be able to talk about your feelings. We don't want you to bottle it up. So therapy is just going to kind of be about that for a little bit. It's going to kind of take a shift and focus on that, which is likely what is needed. So that's what to expect. Thank you for watching. And if you are having thoughts of suicide and you are seeing a therapist, please let them know. You don't have to suffer alone or in silence. You don't have to suffer. It can be treated. So please open up. Please let them know. And if you are having thoughts of suicide and you don't have a therapist, please get a therapist or see a doctor. There are treatments that help. It can make a huge difference in how you feel. So please follow up with that treatment. Thank you for watching.